Gandang Umaga, Filipinas. Good morning. You're watching Eagle News Morning from Canada. I'm Thomas I. Likeness, reporting from our Eagle News studio in the western Canadian province of Alberta. My city is Edmonton, and we're here to bring you news from across the country. Well, we've made it to the end of another week. Good Friday morning. I hope all is well with you. It's going to be another hot day in the forecast in Manila, sunny and the temperature reaching 36 degrees, but it's going to feel more like 41. So again, you're going to want to stay cool there. It's supposed to be a little less humid today, according to the folks at AccuWeather. Right now, though, 30 degrees in Metro Manila, a few clouds in the sky. Let's get that second cup of coffee now. Sit back, relax, and we'll bring you up to date on what's happening in Canada. First, a look at the weather across the country. And our street scene today comes from Toronto. A little bit chilly in Toronto today, too. And you'll see the rain coming down here. This street scene was shot by Eagle News correspondent Marco Zeruto. Thanks, Marco. It's really wet there. That rain is coming down so hard, I might need an umbrella here. I got a few drops on the microphone here, I think. Anyway, lots of sun when we go to Western Canada. Lots of sunshine, 13 degrees in both Vancouver and Victoria. Edmonton at 17. The clouds have moved in up here. Calgary has a few clouds and 14 degrees. We move over to Saskatchewan, where both Regina and Saskatoon are at 14 degrees. Lots of sunshine there, I'm told. Sunny in Winnipeg, but it's a little bit chilly. The temperature only got to 7 degrees today. In Toronto, 7 degrees, and as you can see there, lots of rain. Ottawa got up to 13 with a few clouds. Cloudy and 10 in Montreal. Cool in the Atlantic provinces. Mostly cloudy, and that's all 4 Atlantic provinces. Fredericton got up to 10. Only 3 degrees in Halifax, and light rain reported there. St. John's, Newfoundland, partly sunny and 8 degrees. Well, in the news today, there's been a second death related to that COVID-19 outbreak at a meat processing plant in Alberta, and this one has the Philippine connection. We'll also hear about British Columbia's plan to reopen the province and have an analysis just on how well that province is doing in fighting the infection. A low-cost respirator has been developed at the University of British Columbia. Frontline workers will get a pay raise, and we'll see how the restaurant industry is being helped in Alberta. We begin our broadcast today by offering our condolences to the family of Arwen Salyege of High River, Alberta. Sadly, Arwen's 71-year-old father, Armando, he was visiting from the Philippines. He died of COVID-19. Now, Armando was a widower from General Santos City. He developed symptoms and was taken to hospital on April 23rd. That's the same day that his son was first diagnosed with the illness. 12 days later, Armando died in a Calgary hospital. Arwen worked at the Cargill meat processing plant in High River. Arwen paid tribute to his father on his Facebook page. He wrote, "Pa, we will always remember you. Thank you for making us strong and for your undying words of wisdom." Again, our sympathies are with Arwen's family. Now, we've talked a lot about those big outbreaks of COVID-19 at the 2 huge Alberta beef processing plants. The one owned by Cargill reopened this week after a 14-day shutdown. And there have been questions about the safety of workers on the production lines, not only in that plant, but in other plants. Now, nearly 950 workers at Cargill were infected. Another 566 infected at the JBS plant in Brooks, also in southern Alberta. And Alberta's Chief Medical Officer of Health, Dr. Dina Hinshaw, says her department's keeping a close watch on these plants.
I want to be clear that we are monitoring each of these outbreaks very closely, working with operators to contain the spread, and making sure that all public health measures are being enforced and taken seriously.
Hinshaw says these are some of the measures that are being taking place and being implemented at these plants.
For example, controls in place include staff temperature checks and symptom checks before entering the facility, face masks and other personal protective equipment provided to employees and worn at all times, enhanced cleaning and sanitizing practices, staggered breaks and shift flexibility to prevent gatherings, installing additional sinks where needed to ensure that hand washing can be done while distance is maintained, and increasing distance between employees to ensure 2 meters of separation.
Hinshaw adds that investigations are underway to try to find out the cause of these outbreaks.
I have been told that investigations into Cargill and JBS are now being conducted by Occupational Health and Safety. This will include investigations of any potential non-compliance that may have affected the health and safety of workers at the facility. Complex investigations such as this one can take a significant amount of time to complete. I've been assured that more information will be shared as the situation evolves.
And hopefully that information will give some comfort to workers who've gone back to their jobs at these plants. And again, for those who've lost loved ones to the infection related to these plants, our condolences. British Columbia is the latest province to reveal its plans for restarting the economy. We have details from Eagle News correspondent Archie Rose Natividad-Yee.
In the latest update about COVID-19 in BC, Premier John Horgan has announced BC's restart plan, the next steps for the province in moving through the pandemic. With fewer cases each day and a decline in the rate of transmission, BC has shown a strong effort in flattening the curve, which has led to the province to yield results better than most. To date, there is a total of 2,255 cases and 124 deaths. 1,494 people who tested positive have now recovered. British Columbia has the lowest mortality of any jurisdiction in North America or Europe, with a population of 5 million. With these results, the provincial government is making ways for the province to reopen, easing restrictions by allowing small gatherings of up to 6 people by next weekend, and allowing some parts of the economy to reopen. The Premier emphasized that BC residents must continue to work together to keep the balance of protecting lives and in rebuilding the economy safely. Through the extensive use of mathematical modeling, data showing the movements of British Columbians at 70% physical distancing, and by continuing to follow existing protective measures, the province can expect a further decline in the rate of infections. There is a very cautious approach in restarting the province of British Columbia, with Phase 2 to start in mid-May. The next phase of the restart plan include the following: restoration of health services. This would include rescheduling elective surgeries that were postponed, and other services like dentistry, physiotherapy, and in-person counseling to resume. Small social gatherings, and the opening of more non-essential businesses in keeping with a safe operations plan, using plexiglass barriers and redesigned spaces with distancing in mind. Different organizational sectors will be asked to develop enhanced protocols in line with the public health and safety guidelines in order to move forward with reopening. If the transmission rates remain low and continue to dwindle, the target date for Phase 3 in the restart plan is between June and September of this year. The reopening of additional businesses in the third phase include the following: hotels and resorts, provincial parks and campgrounds, post-secondary and K-12 education with partial reopening in June and full opening in September. British Columbia will only move into Phase 4 once there is a clear indication of community immunity or wide vaccination. This will then extend to the reopening of activities, allowing for large gatherings, major public events, and international tourism. There continues to be a strong emphasis on maintaining physical distancing, regular hand washing, and minimizing non-essential travel. And to quote Premier John Horgan, "There is much more to do, but we will get through this pandemic to better days by working together and keeping each other safe." In Vancouver, Archie Rose Natividad-Yee, Eagle News, we live in interesting times.
Now, before that reopening could take place, the province had to be certain conditions were right, that it was safe to do so. We have Eagle News correspondent Jeanette Duazo standing by. Jeanette, experts say the curve has been flattened. Is that true?
Hi, Tom. Yes, thank you for that. Yes, they officially announced that the province flattened the curve of COVID-19. On May 4th, British Columbia's Provincial Health Officer, Dr. Bonnie Henry, went through the report on how the virus has affected people in the province. In her report, they call it epidemiology, she revealed that from January 1 to April 29, 2020, the total was 2,145 for all 5 health regions in the province. So there's no exception. Overall, there's 5 health regions in the province, and all of them have cases. So ranging from younger than 20 years old to 90 and older, 90 years old and older. And in all the age brackets, there are quite a lot who needed hospitalization and admitted to ICU. So for younger people they cannot stay, only older people will get hit and or die due to COVID-19. So that's a very, very wrong assumption. So for the overall case counts, there are more female between the age of 30 to 60 who got infected by COVID-19. As per the death counts, 1% is between the age of 45 to 50, and 99% is between the age of 60 and older. So of which mostly were male, so for the 99%. As for the healthcare workers, there were 428 cases reported with 1 death. So in her report, as of April 30, the death rates comparison for British Columbia versus the rest of Canada and select countries like Spain, Italy, UK, USA, Germany, British Columbia's number is at the bottom 4 or 5, along with South Korea, Australia, Hong Kong, and New Zealand. So echoing with what Archie just reported on, that yes, in North America, British Columbia is really, really doing well. So also Dr. Henry mentioned that to keep the curve flat in the coming weeks and months, it is important to continue to observe the hierarchy of controls for COVID-19, which came from the infection prevention and disease control world. So that is at the top of the hierarchy is physical distancing. It is more effective measure compared to using personal protective equipment or PPE. As there are still more to know about this virus, and until a vaccine is ready to fight this particular virus, people need to learn how to live with this virus in a safe way that protects themselves and others. So in closing, Dr. Bonnie Henry listed the key principles for the new normal going forward. So quote unquote, new normal. So we have to stay informed, practice good hygiene, washing hands often, the respiratory etiquette, sneezing has to be covered, disinfect frequently, touch surfaces, and staying at home when not feeling well. So there's no exception. If you're not feeling well, stay at home. And also maintaining physical distancing outside the household. Here we can expect to continue to see the engineered controls like space markers in places, in banks, in the stores, plastic glass barriers in store checkouts, and measures will continue to be in place to reduce density of people in places at any given time. Also, consider use of non-medical masks if taking public transit or during shopping, and reducing personal non-essential travels. So the government of British Columbia is very confident we can live with this virus as long as we practice the new principles of the new normal. In British Columbia, Jeanette Duazo, Eagle News, we live in interesting times.
Thank you for that report, Jeanette. I wish we had more time to talk about things like the vaccine, but you made a very good point there that for now we've got to live with this virus. It ain't going anywhere, and it will come back. It will really rage back if we let it get out of control. But until there is a vaccine, really all we can do is just live with it. Thank you again for your report. Still to come, we've got a story about Canadian-made ventilators, and they're at an affordable price, pay raise for essential frontline workers, and helping restaurants survive. This is Eagle News Mornings from Canada.
Magtatagumpay tayo, salamat. Kung mag-fail tayo, salamat. Ang importante po, sinubukan natin, ginawa natin yung makakaya natin.
Napatunayan ko na yung talent na binigay sa akin ng Diyos, mas may expose pa. Kaya sa mga ibang artist dyan, lalo na sa mga may kapansanan din, mag-explore pa tayo ng ibang bagay tulad nito. Huwag tayong magtago, huwag tayong mahihiya. Gawin natin kung ano yung gusto talaga nating gawin.
This program is presented by SMC Infrastructure, building a better world. Sanmig sugar-free white coffee. Puno ng white coffee taste without the sugar, kaya lower calories. Try mo na. Sanmig sugar-free white coffee. Sarap ng white coffee, now sugar-free. Vet-approved Nutri-Chunks, the only premium dog food with active boost for optimum energy and prebiotics that help strengthen immunity. Just like Catherine Bernardo, gawing listo ganado ang fur babies nyo. Listo ganado sa Nutri-Chunks. Co-presented by Hubert, expert in air conditioning and electromechanical. Also engaged in structural, electrical, fire protection, plumbing, and sanitary services. Hubert, your ultimate MEPS and air conditioning solutions. Vita Herbs Philippines Green Coffee. Masarap, mabango, at healthy pa. Canrib Corporation, your ventilation and air conditioning specialist. New San Jose Builders Incorporated. Unlad Incorporated International, fight against global poverty. In participation with Rain or Shine Elastomeric Waterproofing Paint. Color for protection for your home. Matimco. Matimco is wood. Wood is Matimco. R Square Variables Incorporated, your trusted UPS supplier and UPS maintenance provider in Luzon, Visayas, and Mindanao. CompuZell Computer Services, ID card and lanyard manufacturer. Saisho International Trading Corporation. DN Steel. EMAT UPVC Roof Corporation.
Hey, Gretchen Ho here, and I'm a white coffee lover. Creamy kasi, and very yummy. Pero mas masarap kung hindi nakaka-guilty. Check my new discovery, Sanmig Sugar-Free White Coffee. Puno ng white coffee taste without the sugar, kaya lower calories. Try mo na! Sanmig Sugar-Free White Coffee. Sarap ng white coffee, now sugar-free.
The Bulacan Bulk Water Project is a treatment facility that will provide bulk water to the 24 municipalities of Bulacan to meet the increasing water demand of its residents. Through concessionaire, SMC Infrastructure also initiated the significant improvements of the Manila North Harbor Port, the country's busiest port.
Listo at ganado ang baby ko sa vet-approved Nutri-Chunks with active boost and prebiotics na pampalisto. Made with real meat, with essential nutrients to help them grow healthy and happy. Listo, ganado sa Nutri-Chunks.
You're watching Eagle News Mornings from Canada. I'm Thomas I. Likeness. Well, you know, there's nothing like hands-on learning. Eagle News correspondent Kathleen Cruz tells us about some students at the University of British Columbia. Well, they've designed a low-cost ventilator to provide care for severe COVID-19 cases.
The outbreak of the coronavirus pandemic, pressure to provide care for severe cases of COVID-19 was put to the test. Even now, hospitals are strained beyond their limits. There aren't enough resources for PPE and ventilators. As a response to the most pressing need to provide and place readily available ventilators, Code Life Canada has put up a challenge to anywhere from around the world to design low-cost, simple, and easy-to-use ventilators. Here in the province of British Columbia, a group of engineers from the University of British Columbia designed the Flow O2. The design is built from a modified BiPAP machine. Here is Laura, one of the students who designed the prototype.
Instead of trying to build ventilators from the ground up, we are developing an augmented BiPAP system to meet the emergent needs of the COVID-19 crisis. Our system uses a BiPAP, which is available across Canada in clinics and home care settings. The rest of the components that we've added to this device are readily available in your local hardware store or in clinics or from online suppliers. We use standard tubing sizes and have sourced flow meters and other control systems that are readily available online. Our system adds additional components like automated oxygen control and connection to an intubated patient, as well as all the necessary alarms to ensure safety of both the patient and the healthcare providers. The user interacts with a user interface where they can set important values and then set the thresholds of alarms to make sure that our system is working properly.
The average cost to buy conventional ventilators ranges from $25,000 to $50,000. But with the Flow O2 ventilator, the design can be built within just a few $1,000s. The team did not waste any time as the prototype was completed in just 2 weeks' time, while working through online discussions with clinicians and team members and at the same time maintaining physical distancing. It was assessed at a test lung center in Montreal, and it said it has very promising results.
And then this challenge in developing a ventilator was an opportunity for us to also get involved and be able to support our healthcare system with our technical skills or what we've been trained to do.
I think the dedication of the student team on the ventilator project is to me quite incredible. I mean, this is not something they're doing to be famous or to gain any sort of academic credit. In fact, there's no academic that they get out of this. And so they're certainly not doing it for fortune and fame. They're doing it because they want to make an impact. And that's, you know, what I find personally the most impressive about this team.
In Vancouver, Kathleen Cruz, Eagle News. We'll live in interesting times.
Prime Minister Justin Trudeau has reached a deal with the provinces to top up the wages of essential frontline workers. It's a cost-shared deal with the federal government putting up 3/4 of the money.
It will be up to each province and territory to determine who exactly qualifies for this wage increase. But the bottom line is this. If you're risking your health to keep this country moving and you're making minimum wage, you deserve a raise.
The goal of this pay raise is to keep as many of the workers on the job as possible and avoid staff shortages. Well, restaurants have been hard hit by the pandemic. Eagle News correspondent Tiffany Alasasas tells us about what help the government has given to the food service industry and what ordinary people can do.
Canadians from across the country are being encouraged to order takeout or delivery in support of their local restaurants. Since late March, Alberta has forced close contact businesses, such as restaurants, to close their doors, with the exception of delivery and takeout services, in effort to slow the spread of COVID-19. Restaurants Canada released a survey in early April, showing around 800,000 jobs in the country's food service sector has already been lost due to the coronavirus. Another survey says 75% of the restaurants are very or extremely concerned about their level of debt, rent being the main source. Many eateries are unlikely to recover even after lifting the restrictions. The Canadian Emergency Commercial Rent Assistance Program was announced recently following the wage subsidy program that was introduced in April. The CECRA program will help small businesses cover their rent for April, May, and June. Many restaurants are struggling to stay afloat or have even announced permanent closure due to the restrictions which don't allow customers inside the establishment. Instead, restaurants are offering delivery and/or takeout services as a way to help pay their bills. Whether they use Skip the Dishes, Uber Eats, or have an in-house delivery service, you can still enjoy the food you love from the comfort of your home. There are several businesses who now offer contactless delivery as an extra step to help curb the spread. Another way to show your support is by purchasing gift cards. Funds that come from these gift cards are deposited immediately, which can be used to help employers keep their employees. Don't offer gift cards? Ask if they have any merchandise, such as t-shirts and keychains. Every little bit counts. In Calgary, Canada, Tiffany Alisasis, Eagle News. We live in interesting times.
We're racing the clock here, but before I get out of here, just check out more of our great Eagles programming. One such program, Daily Insight. Your hosts, Mayanne Garzon and Randy Bernardino, make it your source of the latest news in business and technology. It's up on Facebook and YouTube. Daily Insight. Be sure to tune that one in. And before I go, you know, it's Mother's Day on Sunday, and I want to wish my mother-in-law, Nanai, happy Mother's Day. My mother, if she was still with us, would have been almost 101 this year. That's our program for today. We'll be back Monday. Thank you for watching, and on behalf of our Canadian news team, I wish you all good health. Take care of others and take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times.